Stand by, we're just having some audio challenges. Now we're on. Okay, thank you. Richard Ball here, Commissioner at Ag and Markets. Thank you for joining in today for an update about HPAI. Before we get started, I want to introduce the folks from Ag and Markets team that are with you this morning.
All right. Good morning, everybody. Elizabeth Walters, Deputy Commissioner here at the department. Excited to be with you all today to talk about HPAI and our response. Tony?
Antonia Giuliano, Senior Policy Advisor here at the department. Good morning, everyone.
Good morning, Katie Howard, also Deputy Commissioner here at the Department of Agriculture and Markets.
Good morning, Casey McHugh. I'm the Director of Division of Milk Control and Dairy Services here at the agency.
And we have Dr. Bennett joining us as well.
Good morning, everyone. Joy Bennett, Director of the Division of Animal Industry.
Great. Thanks so much again for joining us. Quite a bit has happened since we last had an opportunity to be together. A lot happening with multiple federal partners. Quite a lot happening with a lot of national ag partners across the country, with the state departments of ag all as well. And right here in New York with our colleagues at the State Department of Health. So we're looking forward to this opportunity to touch base with you all. Without further ado, let me turn it over to Casey McHugh.
Slides coming up on the screen. Good morning, everyone. Happy to be able to provide a bigger update. As NCIMS chair, I've also been involved kind of on the national rollout, and Dr. Julie Gauthier, who for some of you that participated in those industry webinars, I do apologize. This will be a repeat, but it's really a kind of a reset where we need to get started here to kind of bring you up to date on what we on the inside have called Silo 2.0. I know I've shared with this group the initial FDA, USDA, NCIMS efforts. This was kind of the second cut of that, and we'll go through that. So Katie, if you'd move that forward, please. So again, background, and I'm apologizing here. These are Dr. Gauthier's slides, and out of respect for her, I'm just going to read them because it's not my information. But again, so HPAI reported in the U.S. herd in March 24th, 2024. As of December 11th, 2024, 774 farms with 16 states that have been affected. And then CDC has reported 58 human cases of avian influenza A, which is H5. And then 21 of those are linked to exposure from poultry, infected poultry, and then 35 are associated with exposure to sick dairy cattle, and then 2 are unknown. Next slide. So, as you've heard through these routine updates that we've done, right, how did we end up here? And the silo sampling was identified in the 1.0 project. That was a different set of circumstances, but it was viral load and prevalence, as you heard me say repeatedly over the last month. This one kind of has some modifications, and we're excited to tell you why we're still using silos. So nationally, silo sampling and milk testing determines the presence and also the prevalence of the virus in bulk raw cow's milk at dairy processing facilities. So then the industry, state, and federal partners are going to gain a better insight into the virus and a coordinated and effective initiatives as we collect this data. Ultimately, the goal is to reduce the circulation of the virus from our herds, flocks, and of course people, and then the national strategy to control the spread to other flocks and also dairy cattle. So I'm going to go through this. This is USDA's model, and I'm going to go through that. And when I get to the second bullet, you're going to see plant samplers. And this is going to be repeated, but the plant sampler is the dairy regulator. So please keep that in mind as I work through. So USDA is going to ship supplies to state dairy regulatory agencies. And I'm just going to say state dairy regulatory samplers will be collecting those silo samples And we're using BTUs, and there's a lot of benefits to using BTUs. BTUs are bulk tank units under the international or interstate milk shippers program. It's a traceability aspect that's been in place for decades. We pointed that out to USDA. They were extremely interested in that, and I'll talk more about that as we move through here. So then the dairy regulatory sampler is going to ship those samples from the silos within 4 days. They're going to go to the NBSL lab, and then the NBSL will report out to what is referred to in the animal health world as the SAHO, the state veterinarian, which SAHO stands for State Animal Health Official. And then state officials will be conducting follow-up and herd level investigations as appropriate. USDA has left that up to the individual states. So we're happy to share some of the look through our lens today with you on that. Next slide, please, Deputy Commissioner Howard. So then what are we sampling for? So we're doing a PCR test for presence of influenza A, looking for that genetic material. And then there's also an ELISA test for the presence of influenza A antibodies. If genetic material is detected, they're going to conduct whole genome sequencing to characterize the virus. That's been of interest even in Silo Project 1.0. You know, are those sequences that are showing up kind of already cataloged, or are there new ones on the horizon? Next slide, please. And then the samplers, which again is the dairy regulatory sampler, will record the BTU numbers associated with the milk in the silo at the time of sampling. One of the game-changing events when USDA came to NCIMS for us to work with them is their ability to protect the producer data, and they're not able to protect the processor data. So I want everyone from all aspects of the dairy industry to know there is no data being collected on processors, locations. It is solely BTU numbers associated with the silo that will be submitted for analysis. And then one sample from each silo, and there's some language in here I want to draw your attention to, and that is the silos are containing grade A milk intended for pasteurization at each processing facility that receives grade A bulk raw cow's milk. And that's important. We want to be able to point out that everything was pasteurized at the end of the study. That's important from a human health aspect as well. And again, the grade A milk supply is in excess of 98% of the nation's supply. So USDA is confident we'll be gathering a large, cross section of the dairy industry in one swath. And then, as I've been pointing out, they're the state dairy regulatory officials that are going to be the plant samplers. And then the pasteurized milk ordinance has a requirement that says you have to sample at all facilities 4 out of 6 months. The Cliff Notes version of that, as we refer to it, is monthly. So we will be gathering samples monthly at the processing facilities until USDA determines, makes their bigger picture on when folks are moving across their staged chart to get to a non-impacted scenario. Next slide, please. So then this is just a quick cross section of where we are sampling. So facilities of any size that are receiving grade A raw milk intended for pasteurization. And that will include non-IMS listed facilities. So if you had a cheese plant, for example, that is a non-IMS listed process, cheese is, so the milk supply going in is grade A, so they would have their silos sampled. Next one. And then the not list, where we wouldn't be grabbing a sample, and that's facilities that manufacture raw milk cheese. And there's many categories of that, right? You have aged, thermalized, or otherwise not pasteurized at all. And then other raw milk dairy products from grade A cow's milk. We are not going to be sampling that. And then we will not be sampling facilities that receive only unpasteurized processed raw bulk milk products. And then we will not be sampling facilities that receive only milk from non-IMS listed producers, and unless they are associated with a BTU, because we need to be able to do that trace back. That is an area where many states handle that differently. And so that is why you have that caveat in there. Next slide, please. And then what happens with the data, right? And silo 1.0, that was critical. It's also critical here. And that is the state, the date, and the BTUs identified from the sample, and the identity of the locations of the processors and silos are not recorded by the samplers. We cannot emphasize that enough. That was one of the areas USDA took very seriously about industry concerns. And they noted they could not protect that data, but they can protect the data from farms and BTUs. That was a critical point. State animal health officials are going to be receiving those results. And then this is the state by state, right? We'll collaborate to conduct the follow-up and herd level investigations as appropriate, again, state by state. Next slide. All right, and then the timeline, and let's note that last one there, right? USDA updated the federal order. The federal order did address some areas where it qualified bulk milk hauler samples for our use in the project. So if we could probably drop that in the chat at some point of that federal order, that the language that's in there is important. Also, USDA sending a letter out requesting states to, it basically enroll and get the supplies rolling. And then last week was the webinars that took place. Again, for those of you that participated, thank you so much. There were a ton of questions that came in. Those were recorded and are available on USDA's website. So please feel free if this isn't enough for you. But then again, today is when the sample collection starts nationally.
Okay.
Thanks so much. And then I believe
Do you want to talk New York specific?
Yep. So then talking New York specific. So when Dr. Bennett was to receive a sample coming back through the NBSL as point of contact, we then would determine where, working with our industry folks, to take producer lists and work with our certified milk inspectors and our cooperatives and milk companies to identify where those samples are located. And then our staff will be, meaning the dairy product specialists, there's no burden on industry, the dairy product specialists will go and locate those samples, and we will transfer over into the vials that are going to go to the Cornell Diagnostic Lab. And then the patrons of that BTU will be submitted, and then we'll wait for those results to come back. In the event that it comes back on a positive result, we're going to grab a second sample just to do a recheck. There's a confirmation process that happens at the national level, so we have some time to do that, and that just makes everyone feel more comfortable. And then the impacted producer, I'm not going to go any farther there. That is for Dr. Bennett to share. And so we're pretty excited to have that all fleshed out and to be able to share that with you today. So Dr. Bennett, hand it over to you. Thank you.
Okay, thank you, Casey. Let me see if I can share my slides here. Okay.
Looks good.
Okay, great. So thanks, Casey, and good morning, everyone. Before we cover what happens on the farm when there's a detection or a positive test result, I wanted to give a brief rundown of the status of this outbreak. There we go. I know we heard a little bit from Casey already about where we are. This map was pulled from USDA's website yesterday, but I see that it's already been updated since then. So in total, the number of herds affected is up to 853 herds this morning in 16 states. And when you pull up the map of newly affected herds within the last 30 days, things do look a little different. Currently, only California and Nevada have reported newly affected herds within this time frame. While there's only one affected herd in Nevada, California unfortunately is experiencing the worst of it, with 303 confirmed cases in the last 30 days. I think the key here for the state of New York is going to be early detection, so we can put those safeguards in place to prevent rampant spread like we're seeing in California. And if we can detect it early, we have a better chance of getting a handle on things and then follow in the path of Ohio and North Carolina, which were states that were able to contain the virus and keep it from spreading from the index herd. So in each of those states, it was just that single herd that was affected. So what happens on the farm when HPAI is detected in milk or other samples collected from that farm? Well, first, the farm will be quarantined. No cattle will be permitted to move off the premises, with some exceptions that I will cover in the next few slides. We know from experience with this outbreak in other states that transmission is via live animals, people, and equipment. This particular strain that's affecting dairy farms, which is known as the H5N1 subtype, clade 2344B, genotype B3.13, is pretty efficient at spreading from farm to farm. And through the phylogenetic analysis and testing at the federal lab, we're seeing that this virus is moving from dairy farms to other dairy farms. And also we've seen spillover from dairy farms to poultry farms. Both species are very susceptible to this virus. However, we are seeing those higher mortality rates on poultry farms. So in addition to quarantine, there will be someone from Agriculture and Markets or the USDA asking some questions and collecting information to determine the source of the virus and the risk factors. Generally speaking, this information is collected, then summarized and used to learn more about the epidemiology of this disease. So if a farm is under quarantine, there may be some exceptions made for animals to leave the premises under certain conditions. However, all lactating cattle on the premises are ineligible for movement during the duration of the quarantine. And this is because the virus is highly concentrated in milk, and the risk of spread by movement of lactating cows is high. Movements of other cattle, including dry cows, baby calves, and other non-lactating cows, will be considered on a case-by-case basis, following a risk assessment conducted by the Department of Agriculture and Markets or the USDA. In addition, the farm will need to submit a written biosecurity plan identifying the specific risks on their farm and the strategies they will use to mitigate those risks. In addition, any receiving facility or receiving state would also have to agree to the movement. Many states, including New York, do not allow movement of animals into their state from an affected premises. So you'll need to keep that in mind. So I mentioned farm-specific biosecurity plans for affected farms. We do intend to post a plan template on our website shortly that farmers can use as a guide. Also, if any assistance is needed in creating those plans, the USDA does offer financial support up to $1,500 per premises for farms that would like to hire a service or private entity to develop their site-specific plan. If you want to find out more about funding for this, you can visit the USDA's HPAI and dairy cattle website and click on the Support for Producers tab. While the farm is under quarantine, the Department of Agriculture and Markets will also be conducting zone surveillance around the affected farm. Within the affected zone, which is indicated by the pink area surrounding the infected premises, all dairy farms and commercial poultry farms will be tested weekly for the duration of the quarantine to ensure that the virus isn't spreading, and so that we can take action quickly if the virus is detected on neighboring farms. If results of these tests are negative, there will be no movement restrictions on those farms. In other words, being in close proximity to an affected herd does not mean that you will be automatically restricted from movement. And then in the blue zone, which is the surveillance zone, these farms will be notified so that they can implement enhanced biosecurity in order to protect their animals and personnel. So when can a farm under quarantine expect to be released? Currently, the plan is to follow USDA's Dairy Herd Status Program. And in order to change classification from a herd to monitored unaffected herd, from affected to unaffected, the farm will need to have 2 consecutive weeks of negative bulk tank test results and 1 negative hospital pen test result, concurrent with the second bulk tank test. Also, the herd will need to show absence of clinical signs for at least 2 weeks, including absence of production changes like drop in milk and absence of illness, such as mastitis and respiratory disease, above what's expected for baseline. So Casey already covered this, that there have been 58 cases of H5N1 reported in people, with 56 of those cases having a known history of the individual having contact with infected cattle or poultry. Rumor has it that the real number is higher than 58, but as you're aware, not every case goes reported. Farms should also be aware that if they have a positive test result, the local Department of Health may be in contact with them to discuss zoonotic disease concerns, monitoring workers for illness, and the testing that's available for people. The CDC has issued stricter guidelines for the personal protective equipment recommendations due to the uptick in human infections. However, most cases in people have been mild up to this point, but there's always a chance that the virus could change to a more virulent form that may cause more severe illness or enable it to be transmitted from person to person. This is my last slide. Just wanted to finish with the federal support programs that are currently available through the USDA. Again, it's covered in depth on their website. Some of the funding opportunities are only available for affected dairies, some for unaffected dairies, and some are available for all producers. So the biosecurity planning implementation support is available to all dairy farms up to $1,500 per premises. This can help farms that have frequent visitors and vehicles and other risk factors. It can also pay for biosecurity trainings for staff and to perform audits. The reimbursement for shipping costs is available for all dairy producers up to $100 per premises per month, not to exceed $50 per shipment. The reimbursement for veterinary costs to collect samples is available for unaffected dairy producers only, up to $2,000 per premises. And we had a number of producers in New York take advantage of that during the fair season, when testing was required to enter fairs. Veterinary costs associated with confirmed positive premises is available to dairy producers with affected herds, and that's up to $10,000 per premises. And that can cover things like veterinarian's fees and supplies for HPAI related animal treatments and sample collection. And it can also cover labor hours for farm workers to administer treatments. The USDA also provides support for personal protective equipment for those individuals that will be working directly with animals, and that is up to $2,000 per premises. Heat treatment to dispose of milk is available for producers with affected herds, and that is up to $2,000 per month, up to $8,000 total per affected premises. And they're also providing funding for milk loss through the USDA's Farm Service Agency. This is through ELAP, or the Emergency Assistance for Livestock, Honeybees, and Farm Raised Fish Program. So have a look at the USDA website for more information about what funding is available. It explains the process, how to apply, and who to contact for more information. And that is all I have for the slides, but I also just wanted to mention that if and when we have our first case in New York, we will issue a press release so everyone's notified right away. But any subsequent cases will be posted on our websites, similar to the process we use for poultry. I think we have 27 cases in poultry posted currently in New York since the start of the outbreak, which was in early 2022. But we intend to post the confirmed cases of dairy cattle as well, just the date of confirmation and the county that the case is located in. And that's all I have. So back to you, Katie.
Thank you, Dr. Bennett. I'll turn it over to Elizabeth real quick.
Thank you so much, Dr. Bennett. I think we just really want to highlight the challenges that we've seen in other states with the disease moving from farm to farm, and the importance of the quarantine measures for affected farms, so that if this is detected here in New York, we can hopefully put a quick stop to it and not have it spread from facility to facility. I also just want to quickly mention, I did share in the chat, excuse me, both the federal order that Casey mentioned, and then also the general USDA website. I hope you're familiar with this, but you can find on this page testing numbers, links to all the producer support programs, and all the up-to-date information from USDA on that one website. So Katie, I'll turn it to you for questions.
Sounds good. And before we dive into questions, I did want to highlight that we are going to be putting together an industry handout to kind of summarize some of the high level items that we're talking about here today. So I know that there's a lot being thrown at you. I appreciate your patience, but I also understand it could feel like you're drinking from a fire hose. So we will be preparing that industry handout as well. So that will be forthcoming. I'm going to first go through the chat. If you have a question, feel free to put it right in the chat. We're going to work through as many questions as we can, and I do see a few folks have their hand raised. So let's dive right into it. The first is, how soon do you expect to begin sampling? At this point in time, we are hoping for a sampling start date of January, but we are still working through some final details. So if that changes, we will be certain to let our industry partners know. The next one is, will processors be notified as to day of sampling? As Casey mentioned, the samples will be taken by our dairy product specialist. So that is going to occur during your routine monthly sampling already. So it should have minimal interruption into your regular processing schedule. I see in the chat that Elizabeth did drop in the link. So again, please check that out when you get a moment. Yes. So question to you, Casey, to clarify, if a silo is found positive, all farms in the listed BTUs will be sampled?
Yes. Yep, and I can talk a little further about that. So there were some other studies, folks, that were, and we think they've stopped and have gone to this national structure, but they were going to be sampling in their respective states and only writing down the state for which the milk came from. So that would implicate every one of our producers. And so that we'd be looking at every time, even if we were in a silo in another state with an impacted state, we would have to sample our entire dairy producer, portfolio. So the BTU model, and in talking through that with a number of our cooperatives, we think that number is between 30 and 40 patrons per BTU, 50 on the higher side with a few outliers, but it's a far more manageable number for us to do traceback with. Thank you.
Yep. And actually to work off of that response as well, there is a question in regards to the sensitivity of the silo sampling. And can we really get it down to the BTU? USDA has indicated that the testing that has been conducted on the silos would be sensitive enough to pick up a positive or a non-negative PCR test. So they do feel confident that we would be able to detect a high path positive farm from those silos, even if there were 30 to 50 farms in that silo at a time.
And the only thing I wanted to add to that, Deputy Commissioner Howard, would be the fact that it's surveillance. So again, it's monthly. It's not a one and done. USDA is confident that because this is going to be monthly for a period of time, they're going to get a great cross section. And I do want to add Silo 1.0 that concluded first week of December, that had 400 samples in that data set, and yeah, nationally. And I'm going to say it this way: it was less than a handful of positives. And again, that's a national snapshot. So we all feel good about that.
So there is a question with regard to, since pasteurization kills the virus, why was the decision made to only test samples of milk that were pasteurized? And with that, I'm wondering if you can speak a little bit to raw milk.
So I'll start with the first part of that question, and that is both FDA in Silo 1.0 and USDA in this Silo Study 2.0. They all have an Office of Chief Counsel. And in all the discussions that took place, they ultimately landed at a place that it will all be milk that's going for pasteurization. and then further the supporting numbers that I shared, that the majority of the US population, or excuse me, the milk supply is in excess of 98% grade A. So we'll be getting, you know, the majority of the milk supply through this monitoring.
Thank you. This one is to you, Dr. Bennett. Will there be feed delivery restrictions with quarantine or infected areas?
Feed delivery restrictions, no. However, affected farms will need to develop a biosecurity plan to mitigate any risks associated with any deliveries or service providers that come onto the farm, vehicle flow, and you know, other risk factors that might be specific to that farm.
Thank you. Back to you, Casey. With respect to other states, do you know if NCIMS silo sampling will begin nationwide, including in states that have already begun their own sampling initiatives?
I appreciate that question because that is something I wanted to make sure we worked in. USDA was very clear that those states, especially I'll call your attention to those states that were in that original group during the webinar that they talked about. The initial 6 were not just doing the silo monitoring. They were already states that were engaged with USDA in some sort of fashion. Many of those are impacted states or were and are doing additional testing. So if a state is already implementing their own bulk tank sampling of their own state's producers, it would make no sense for them to step back, if you will, to the higher level silo sampling. So USDA is very used to working with individual states who if they feel strongly that a certain approach is where they want to go, they respect that, as long as they're getting some sort of a snapshot of producers so that they can, again, identify prevalence and categorize those sequences that are out there.
And Casey, still to you, with the recognition that some of our folks on the line may not be as familiar with the processing or producing level, can you please define silo?
Process, I would say it this way. I would say make sure we're talking about processor silo. We respect and recognize that some larger dairy producer, meaning farmers, have silos for on-farm bulk milk storage. The definition of a silo is at a processing facility that is receiving grade A milk in bulk. And I hope that clarifies that. And if I didn't answer that to the submitters, comfort level, please ask for clarification there. But only at a processing facility that will be unnamed in this study.
Okay, and Dr. Bennett, what is the expected radius around an infected facility to be restricted?
The infected zone is 3 kilometers, and just to reiterate that the farms in that area will not be restricted from movements unless they test positive, but we will be testing farms on a weekly basis to ensure that the virus hasn't spread to neighboring farms.
And then with regard to an infected premise, how is the identity of a non-negative farm protected when there will be radius for testing?
The department will not release specific information on the farm, but we will need to test farms in close proximity. I don't know if anyone else wants to add to that as far as confidentiality.
I think that's correct, Dr. Bennett. Thank you so much. If a farm has many locations or satellite locations, will you be quarantining all satellite locations or just the premise or location that tests non-negative?
Separate locations with separate premises identification numbers will not be automatically quarantined. However, there will be an epidemiological investigation centered on the affected herd and any other herds with links to that herd will be tested and investigated. And then if additional herds come up with positive results, that's when the quarantine will be placed.
Thank you, Dr. Bennett. Casey, will all silos at the plant be sampled?
Yes. Silo 1.0 was a sample, or excuse me, a silo at a processing plant. USDA wanted a cross-section of all of the silos at a plant.
And then I believe we may have answered this earlier, but just in case, the question was within a BTU, if you had, say, a 30 cow farm, will high pass still be detected if that farm is a minimal contributor to that silo? Indication from USDA is that yes, the PCR test is sensitive enough to pick up that non-negative detection.
And if I could add on there too, you know, we are also putting a lot of responsibility onto our producers as well. If you do suspect, or your veterinarian suspects that you have an impacted animal, you're seeing clinical signs, please make sure that you're following through with that and getting testing done.
There was a discussion of zones for testing of dairy and poultry farms around a positive herd. Is there similar zoning to expand testing to dairy poultry farms around a poultry farm that is found to test positive for H5N1?
Yes, we have implemented control areas and surveillance zones since the beginning of the outbreak with affected poultry farms.
And Dr. Bennett, what will be the different requirements of farms in those surveillance and infected zones?
Within the infected zone, which was that pink area, the immediate area surrounding the affected farm, those farms will be required to test weekly. And then in the surveillance zone, which incorporates 10 kilometers around the infected premises, those farms will be notified and contacted, and just to make sure that they understand that if they notice anything, you know, any clinical illness in their herds or their flocks, that they need to contact us immediately. And also so that they can step up their biosecurity and protect their animals and their workers.
Thank you. And still to you, Dr. Bennett, when a silo comes back positive, are all 40 plus farms on quarantine initially until more testing is done? Or is that not done until after confirmation?
We are not quarantining all the farms from the BTU. We will be quarantining based on the positive individual bulk tank result.
Thank you. And then Dr. Bennett, you did mention the financial incentives that are there from the federal government. Is there any planned financial support to compensate affected dairy producers for lost calf or cull cow sales if their animals cannot be moved?
I'm not aware of any funding at this time for those purposes.
Okay. Those are all the questions I see in the chat, but we still have time. So if you have more, please feel free to put them in. Otherwise, I do see we have a few folks. We have one person with their hand raised. So Ashley, you are now off mute. Feel free to ask your question. If you're speaking, I don't believe we can hear you. But what I can go ahead and do, Ashley, if you want to drop a item in the chat, I'm happy to answer any question that you may have. Okay, we do have a few more questions that have come in. So testing mentioned PCR and antibody testing. Will there be any follow-up testing for any infectivity testing for any samples?
I'm not sure I'm understanding. Is that for Dr. Bennett? Infectivity? I'm not.
I don't know
familiar
what
with
that
term.
is. Yeah.
Okay, if you post that question in the chat, if we could just get a little bit more information on what you're asking, that would be wonderful. I did have a couple of folks ask if this meeting has been recorded and can, for those that may have had a conflict during this time, it will be recorded. So that will be distributed shortly. as soon as we can get it online.
The egg test.
Yeah, so Dr. Bennett, I believe the question is referring to the follow-up confirmation testing, and I believe that will be done after
Yes.
the BTU sampling, correct?
Yes, all positive tests from non-labs are confirmed at NVSL, the federal lab, the National Veterinary Services Laboratory. And at that lab, in addition to repeating the PCR test, they also sequence the virus so they can determine the strain, and do virus isolation as well.
And Dr. Bennett, can you speak to the latest thinking on how most of the spread is occurring?
Yes, spread is occurring through live animals, people, and equipment. I think that the majority of the spread is that is how it's happening. There may be other ways as well that further investigation, may bring into the picture, but those are the major ways of spread.
Yeah. And just to reiterate, that's why it is so important that we are being particularly cautious around the movement protocols of both lactating and non-lactating dairy animals. Are we expected to compost cull cows on farm?
Well, farms may have different options for disposal. That's something you can discuss with your in biosecurity planning. And there's movement to slaughter for non-lactating cattle could also be an option depending on the circumstances. But for lactating cattle, you would need to just go. You'll have to plan for disposal methods on the farm. I also want to say that we're looking at, on average, 3 to 4 weeks under quarantine. That's what it's been in other states, the average length of infection time. Some farms have been longer than that, and some farms have been shorter.
Thank you. A question was posed about reiterating how many farms are included in a BTU unit. That is very specific to the processor, so it could be 30 to 40.
Yeah, producer, yep.
Producer.
So the producer, the cooperative, we just gave an average because they're almost geographic and regional in some degree. So there is no like set requirement, thou shall have an X number. It's whatever the cooperative. There are some that have over 100 in one BTU, but those are extremely rare. That's why I just shared numbers on the average and how that's just a much more manageable number for traceback.
Okay. And how are we defining a dry cow?
The USDA defines lactating cow as a cow that's leaking milk. So, a dry cow would be a cow, I think, that's not producing milk.
And then Dr. Bennett, to you as well, with regard to those farms under quarantine, what would be the implications of flocking birds, for example, starlings?
We don't know yet how starlings and other pests, we don't know the exact role they play in the transmission of this particular virus. But I would recommend that farms pay attention to wildlife and pest control around their farms and make sure that is addressed in their biosecurity plan. And Wildlife Services, USDA Wildlife Services is the agency that can help with starling control.
Is there any indication from the CDC of increased employee protection requirements at production facilities if a positive test is found in one of their silos?
there's the recommendations that have gone on. I can only speak to my colleagues, right? They made PPE available, whether it was, you know, the milk companies or states themselves for their own personnel. But I really don't have, with us being a non-impacted state, I don't really have any more information to share other than just the availability of PPE for those folks.
Yep, and to reiterate a point that Casey made earlier, the processor information is not being collected during the course of that initial sampling. So that would be something that we
There
wouldn't
is
otherwise
no-
be able to trace back
That's
to
right.
the processing silo.
Yep.
The question about are cows asymptomatic but testing positive for the antibodies? Dr. Bennett.
So any action that we take on a farm will be dependent on a positive PCR test. But cows can be asymptomatic prior to, they can test positive on the PCR test prior to showing any symptoms. So, you know, that situation could occur, but we would need a positive PCR in order to quarantine a farm, not an antibody test.
You know, I'd like to go back actually on that previous question too. I think it's important for everybody to kind of take a step back too and look at it. Raw milk, just by the way it's handled in a processing plant, we have a separation between the areas in the plant where raw milk is and pasteurized products. Those personnel don't go in between. Raw milk over history has been known to contain pathogens. And so whether it's tuberculosis, brucellosis, for those states that are impacted by those pathogens, we have that separation. We have our milk handling systems that helps reduce that. The pasteurizer itself, that thermal process, folks, I'm gonna continue to bang that drum that we are so fortunate that FDA, USDA study on pasteurization showed that our thermal process is overwhelmingly effective at inactivating that virus. And so, you know, when I think of a milk process, you know, the plant process to get that milk brought in and unloaded, yes, there's some exposure there, but you know, the rest of it is pretty much all encapsulated in piping as it works its way, you know, once it gets into the pipe system, and the exposure there is quite minimal. For those impacted states, I did not hear of, you know, staff being impacted, plant staff being impacted. We had a number of industry representatives that were on the Tiger Team discussions in impacted states, and we just didn't hear about that. So I just wanted to share that little bit of background.
Okay. There was a question again, just to go through who is testing when. So just to reiterate, those silo samples will be tested at the NVSL, the National Veterinary Services Lab, and the identified BTU samples, if there is a non-negative identified, will be tested at Cornell. If a silo tests positive for antibodies but not genetic material, so PCR negative, will there be follow-up herd level testing?
I'm looking to you on that one, Dr. Bennett.
Okay, yes, the herd will be tested by PCR.
Are there examples of only one farm in a BTU? Is there special consideration needed for confidentiality in those cases?
So there's not, because that information is protected by USDA producer information. So single farm BTU, even if it's a multi-farm BTU, USDA can protect that data so that it's not publicly available.
Just to reiterate the frequency of testing, the testing at the silo will be taking place on a monthly basis. That is going to occur during the monthly sampling already taken by the dairy product specialist. And then there's a question about an observation made with regard to other states and how they are handling the approach to responding to HPAI. So we are in close contact with our counterparts in the states and meet regularly with them. So there are a lot of lessons that we've learned, a lot of best practices, and some areas where we've taken them as learning opportunities. So we are continuing that conversation. So we are certainly paying attention to what is happening on a national level.
And again, this is why we are taking a hard line on quarantine, is because that's the lesson we've learned. You need to stop movement of sick animals.
Hey, and I think that is the end of the chat, but just to reiterate, this has been recorded and we will be working on industry guidance. If there are questions, certainly let us know. We are here to really kind of help you through this process. We have another question. Can New York protect producer data through the course of activity for testing? So how are we protecting producer data?
Dr. Bennett, would that be under the cooperative agreement with USDA?
Yes, any cooperative agreement information is protected.
And I just want to add, that was a game changer for us on the milk regulatory side. We did not have that under the FDA-led initiative in the beginning. And I can attest to, National Milk, International Dairy Foods Association, those folks were very concerned about that information getting out and how it could be used against them. And this is really with USDA being able to produce or protect the BTU level and producer, that was a game changer in allowing this project to move forward. And I've seen questions where, and Julie and I got it on the Dr. Gauthier, and I got that on the webinar. Why didn't we do this back in April, right? That question came in, and that is why those groups were not comfortable, because that information could not be protected. And this is a win in that regard, to be able to get that snapshot and not have it be public.
Okay. There was a question with regard to where will this link be found. I believe that this will be available on our website, or a link through our website. I suspect based on the size, it may have to go to another platform. But more to come on that as well. We'll see how big a file it is when we're done. But with that, I believe we have all of our questions answered.
Amanda raised her hand.
Yes, we do. Okay. Amanda, I see you raised your hand. You are off mute. Go ahead.
Quarantine as soon as possible, why would we not test on a farm by farm basis? And in terms of your PCR and having us recognize, well, if you have symptoms in your herd, but you just said you can be asymptomatic and not be detected right away. So would not a farm by farm basis be the quickest way to find a positive farm? Because even if even once a month test doesn't seem very frequent to be testing, if you're really trying to catch positive herds and isolate them as soon as possible. A lot of movement can happen in a month, and even by that testing, you would need to go through the whole BTU, which takes even more time. So you're looking at what, 5 or 6 weeks before a positive herd can be identified and quarantined?
Yeah, I can, Casey here, I can jump in on, Amanda, the portion about the BTU. Milk's coming off the farm every other day. We would be, or daily, we would be working with the cooperative to get those hauler samples for that BTU, and we would be able to get those within a couple days. So we would have that cross section submitted as a group to the Cornell Diagnostic Laboratory. And we're pretty fortunate here in New York, just with the way my field staff is structured, and the fact that we have some large commercial labs that carry a major portion of those samples, that they're also in the same zip code as the diagnostic lab.
And I think the other thing, and Dr. Bennett, I would turn it over to you or Deputy Commissioner Walters. I think, one of the things that I will say, and I'm knocking on wood as I say this, is that we have no reason to believe at this point in time that we have high path in New York. New York State has been very aggressive in our testing efforts already, and Dr. Bennett or Deputy Commissioner Walters, I don't know if you want to speak to what has already taken place here in New York State.
Yeah, we've been testing for movement. And Dr. Bennett, you can correct me when I'm wrong. But we've been, we require testing for fair participation and show participation. movement into state we've required. So we're over 7,000 samples already. I know that I haven't updated that number in a couple of weeks. But we are testing in New York and have not found it. We've had a number of suspect premises. We've tested those. Those have come back negative. So we do have a snapshot. We're feeling okay. But we understand that, you know, this is a concern nationwide, and we are not on an island, and we do have movement coming in and out of the state. So we think this is important, and this is a good step to figure out if we do have high path in the state. Want to correct me?
Oh,
Go ahead.
Nope, that sounds good. Nothing to add.
And the only thing I would add, Amanda, to your question also is, you know, in those states, many of those states that took that on and did the individual farms, some of them did not have very many farms, right? So some of those states, less than 100, right? That's a far more manageable number. We're very proud of our number here in New York, multiple thousand dairies, and that's just a far bigger project that, with everything USDA brought to us and the decision was made that the sensitivity's there, and at a monthly basis from surveillance, everybody's happy. And that's the road we're gonna go down.
There was a comment made with regard to the need to rely on testing to source infected farms, because farms will be less likely to come forward if their herd will be quarantined and no ability to cash in on problem cows. In just a moment, I will turn it over to Deputy Commissioner Walters and Dr. Bennett to kind of talk through some of the orders, but I would want to note, and I want to emphasize here, this is more than just the dairy industry that this impacts. We do have a very strong and important poultry industry here in New York State. The dairy industry is fortunate. The mortality in cows is very low. Poultry, it is devastating to their flocks. So it is really important to be a good neighbor. So just keep that in mind. But Dr. Bennett and Deputy Commissioner Walters, if you want to speak a little bit to the orders in place with regard to requiring testing if symptomatic.
Symptomatic?
So are you speaking about the requirement to report disease?
Correct, yes.
Yeah, so yes, state regulation that if animals are experiencing symptoms with any reportable disease, and HPAI is a reportable disease in any species in New York, it must be reported to the Department of Agriculture and Markets or the USDA.
Thank you, Dr. Bennett. So bottom line, be a good neighbor.
Follow the law.
Testing taking place. So testing is going to occur at all processors across New York, and that is going to occur on that monthly basis. A question, if a farm is positive, how long are they tested and how are they tested? Dr. Bennett, can you reiterate that?
Yeah, so in order to be released from quarantine, a farm would need 2 negative PCR tests on bulk tank milk. And so that's 2 consecutive weeks of negative testing. So generally speaking, these farms are tested on a weekly basis, and that can start right away. That testing can start, you know, immediately after detection.
Okay. Okay. Another question that was posed is, what would testing look like for those farms in that 3-kilometer radius for the positive zone?
Yeah, so if it's a dairy farm, it would be the weekly bulk tank test that Division of Milk Control and Dairy Services would assist with. And then if it was a poultry flock, that would be the standard testing protocol that's for HPAI. And generally that's 1 tube of 11, if it's chickens, 1 tube of 11 birds of sick and dying birds. But that's we would use the same protocols we've used since the beginning of the outbreak.
And that would be the same if that farm in question was still negative in that positive zone, correct?
Yes, that's correct. Until the quarantine is released on the infected farm.
And who is performing that testing on farm?
That can be a variety of different people. Depending on the situation, there were, in some states, there were very, very many flocks that were in zones that had to be tested. So they were, sometimes they were being submitted by farm owners or accredited veterinarians or Department of Agriculture personnel. So that can vary.
Thank you, Dr. Bennett. So I do see that we are at time, and it does look like the questions have now all been answered. So with that, I'm going to turn it back over to Commissioner Ball.
Thank you, Katie. There's an awful lot of input here. Initially and ongoing, FDA, USDA, CDC, the State Department of Animal Health officials, NASA, that's the State Departments of Ag, the Departments of Health across the state. In silo testing 1.0, as Casey refers to it, New York was engaged there, fully engaged. And the fact that we had the additional movement restrictions here, I think put us in a good place. 2.0 is a step forward. The endorsement of all the agencies I mentioned, National Milk, IDFA. I think this is the right step. It's the right step forward. I feel comfortable with the restrictions that we have in New York on movement, that we're doing the best thing we can right here. And I really want to acknowledge the intense cooperation between NCIMS, USDA, and the State Departments of Ag. We're very fortunate to have Casey at the helm of NCIMS and engaged in these conversations. Dr. Bennett being engaged in these conversations with the State Departments of Animal Health across the country. And we're fortunate to have in New York this particular team here, the deputy commissioners in Antonia that are with you. So I would just add that if you have additional questions, concerns, please feel free to reach out to us. And, we'll maintain that open line with you guys. Ask a question, we'll get right back to you. So thanks for your time today. We appreciate this opportunity to kind of clear the air and get everybody up to speed with where we are. Thank you.
Thank you, everyone.
Thank you.